This is Cindy Atwell. I am going over my teaching plan for the medications of the autonomic nervous system. Before the students come to class, they should have read chapters 34 from Essentials of Pathophysiology and Concepts of Altered States, and viewed the YouTube video Autonomic Nervous System Crash Course, as well as chapters 13 and 3 from Pharmacology for Nurse and a Pathophysiological Approach. Once they're in class, using the muddiest point approach, we would review and go over any questions they might have, anything that we need to pinpoint, and then complete a pretest just as another review for them to see if there's anything else we need to go over. After the pretest, then we will go into the lecture and review the functions of the autonomic nervous system to include sympathetic and parasympathetic, fight or flight versus rest and digest. Many people think of that as the sympathetic as a fight or flight, but it also controls your blood pressure, your arterial pressure, and tone. It changes with exercise. Change of position can also affect it. And just review some things just to make sure they have a good basis for what's going on. Make sure they understand the two systems can work together in synchrony, that they can work together or work against each other to create an equilibrium. And they also work independently of each other, depending on the parts of the bodies that they touch. Go over the body temperature, respirations, digestion, elimination, blood flow, blood pressure, pupils, GI stimulation or decreasing stimulation, blood sugars. Talk about the preganglionic and postganglionic neurons, visceral sensory fibers, and where they're found in your head and trunk, mainly in the main parts of your body is where they're found, and they work on everything else. Talk about the nicotinic, muscarinic receptors, your cholinergic, acetylcholine, and the dysautonomy, which is the loss or the gain of all or partial function of these areas. Talk about norepinephrine, epinephrine, acetylcholine. Discuss dysautonomy and where it can come from. Drugs can cause it, whether they're chemotherapeutic type drugs or street drugs. Damage from brain injury, a physiological kind of thing. Alzheimer's and stuff, diseases that come from it, as well as venoms from spider bites, snake bites that can cause some problems. Once we get to this point, we'll work with felt boards. We'll break into groups and allow them to map out the preganglionic, postganglionic, and try to go from talk about the areas that they affect, talk about the different body areas, and just kind of put what you're seeing, what you're hearing, what you're saying, and put it into fingers. I know that sounds elementary, but that's how we learn, by seeing, hearing, doing. And so bring in some fun and laughter. Play like what was that game? Operation type game, and have jelly bean treats or something. Then we go into the genetic and genomics and how it has opened up so many avenues regarding complex disease. Talk about the fact that there are over 200 genetic loci associated with the autoimmune diseases, and many of them which are linked. It's like Crohn's, lupus, and psoriasis. They all tend to be found in the same area. They can kind of be treated in the same ways with the same medications. Then we'll review signs and symptoms that we would see, things we would check for: your orthostatic intolerance, heat intolerance, loss of bowel and bladder control, erectile dysfunction, and things as simple as dry eyes and our mouth. When somebody continues to complain about that and you know that there's no reason for it, maybe there's a thing to start questioning and finding, seeing what other symptoms they might have. Physical exams could include the postural, blood pressure, and heart rate. So we can sit there in class and do some orthostatics and do them after playing games, just doing after running around, just something to get us moving so we're not sitting and listening to lecture all day long. Eye exams, GU, and rectal reflexes are other things when you start getting into some of the bowel and bladder issues. are the loss of sensation, numbness when you get into MS and ALS and different things like that. There are other things you go over. The labs, sweat test, the cardiovagal test, where when you're sitting doing an ECG and you do the Valsalva muscle maneuver. If we had time, you sit there and do some of these and see how it can affect you. Head tilt, plasma norepinephrine. And then once we get into this, then we go into our medications, talk about the neurotransmitters and mediators, the primary mediator of the postganglion being norepinephrine, the CNS mediator being dopamine, and the catecholamines, when you group together norepinephrine, epinephrine, and dopamine, they're considered your catecholamines. The mediator for both the sympathetic and parasympathetic acetylcholine. Then we can go into the different medications, botulinum toxin, even though this is something that you don't want to get. You don't want to eat bad foods and have be affected by the botulinum toxin. It's been found to be effective on dystonias and spastic disorders. The anticholinergics, atropine for dysrhythmias and diarrhea, oxybutynin for bladder control. The beta blockers and alpha blockers, atenolol, metoprolol, carvedilol, and tamsulosin, and the way they affect glucocorticoids, how they are effective in asthmas and cancers. They're used in complete melanoma treatments and stuff. They're part of it. Inflammatory diseases, how it will help. Your MAO inhibitors for treatments of depression or Parkinson's, such as Nardel. Cholesterinase inhibitors, pilocarpine for excessive salivation and fluids, physostigmine for glaucoma and as an antidote toward venomous bites, neostigmine for myasthenia gravis, carbidopa that prevents formation of peripheral dopamine, and it's used in Parkinson's. Once we've gone over the medications and take a little break, talk about them, have a question and answer time, then we also need to view the YouTube video, the 10 Rights of Medication, so that we can again view the right medication, right patient, right dose, right route, right time, right pre-assessment, right of the patient to refuse the medication, right education to make sure when they refuse, they know what they're refusing, right evaluation following post, and then the right documentation, because if you didn't document it, you didn't do it. On completion of this, we'll go over case studies, break into groups again. Groups, when you work in groups, as an RN, you are not going to be the one that takes care of the patient, so you want people to learn to work in groups. I, for one, have a hard time with that sometimes. I like to work with my doc, but there are sometimes that it's just very annoying to work in groups like this. Teaches you patience. It teaches you to listen to other people, to pick up on ideas, and you can add some fun to it. Keep points and allow for candy bars. Whoever gets the most candy bars and hits the most points right, it allows them to get extra points on their test maybe. After we're done with that, we have everybody get up and speak. And again, you learn how to talk to people. You learn how to present in groups. You learn to get past things. Like doing these videos, I have learned that I hate doing videos. I'm not very good at it. I stumble and stutter. This is the 4th time I've done it because I tend to, when I get nervous, I scratch my head. I was watching the first one and all I did was scratch my head, so I had to redo it. Made me look like I had bugs or something. After completion of the verbal presentations of the case studies, we'll have another question and answer time, review, and then have an open book test. Open book test take longer. They're not as fun, but it helps, especially the pre-licensure nurse. It helps you to learn to start delving into things, and also make sure you've read it, because once you've read something, you kind of know where to go back to. So again, it does the seeing, hearing, doing. It adds those in there. Anyway, maybe it's not all fun, but it's different ways to involve you and involve using different tactile sensory that we have to learn and apply. Thank you for this semester. I have definitely learned where I need to go and what I need to do, and that I have a long way to go. I appreciate your time.